Welcome. Thank you for joining ICRC-TV COVID-19 HR updates. My name is Pandy Pridemore. I'm your host today, and I think we've got a really nice show for you. Today, we're going to talk about the top 10 things to do to be more profitable in your business. I know, we can associate this with COVID, because let's think about this, guys. Haven't we said from the very beginning, when this show started back in March, that life as we know it, as entrepreneurs or as business owners, it's changed. There's no going back. We've got to start seeing our businesses and the way we do our business a little differently. And if we're going to look at it differently, then for goodness sakes, we should all be thinking about profitability, right? And you don't have to be the business owner for this information to be very pertinent or relevant for you. These are going to be great notes, and Bill Hesh is with us. Bill's been with on the show before. He's founder and president of Bill Hesh. Oh my gosh, he owns 2 companies. He's an attorney, he's a CPA, he's a financial planner. He knows this topic. So you're going to enjoy what he's got to say, and you're going to want to take it back to your business leaders. Today, we're going to start on a whole different direction. I've got Mike Samet here, public health officer with the Hamilton County Public Health Division. Geez, that ran pretty well. It took me weeks to get this guy in on the show. So this is a big accomplishment for me, because everyone has been using the health department as a bit of a fear tactic, or we've been talking about what they're doing over there and all the processes and policies that they're putting in place and how it kept changing every other day. And are they going to come in through our doors, and what do they really expect from us? Well, Mike is here to help us look through all that. And better yet, Mike and I, in our early pre-show discussions, started talking about all the things that we need to be thinking about moving forward and what the health department would like to help with the public. So why don't we just get started? By the way, I'm Pandy Pridemore, principal consultant with the Human Resource USA. I think most of you already know that, right? So Mike, thank you for joining the show.
Thank you for having me. Appreciate it.
No, we're lucky to have you. Come on, you got to admit, it took a couple of weeks to get us on the phone together.
That's because I have terrible phone manners, but no, it's been quite a circus here in public health since the beginning of the year. So I apologize. It's taken me a little while. The demands on our time are pretty incredible right now, but we're chipping away.
Well, we feel privileged that you did make time in your schedule, because again, we know just how busy, or maybe we don't fully understand how busy you guys have been. Help us understand what's been going on since this started 5 months ago.
Well, this is certainly for me, the most interesting time I've ever had in public health. This is a once in 100-year event. We've had epidemics in the past. We've had disease outbreaks in the past. Every year, we have school disease outbreaks, but this is truly a global pandemic. Which has made its way, as we all know, and again, not to beat on history here, but from China all the way through here. United States is leading the world in cases, and unfortunately in the deaths that are lagging indicators behind number of cases. And we are trying to work through this as we speak. It's a challenge. It's a novel virus. You had mentioned at the beginning of your remarks that the changing dynamic, the way we have changed in terms of guidance. Well, yes, we have. And unfortunately, that is just the nature of the virus that we're in right now, is because it's a novel virus and we're learning so much every day that the guidance changes. For instance, we learned early on, please don't wear a face mask. The Surgeon General came on TV and said, please, it's not necessary for you to wear face masks. Well, as we learned more and more about the virus and learned that, in fact, it is transmissible through respiratory droplets, through normal talking, through proximity with one another, a mask then became a good idea. So for the public out there that may have a little bit of whiplash from our direction, I feel their pain. We've had the same thing, and we rode along with the changes in direction as they've come. But it remains a novel virus. As you can see, there's no vaccine for it quite yet, although we did get the indicator from the CDC that we, as public health agencies, need to start ramping up for potential distribution. That doesn't mean there's a virus. We know nothing about an imminent virus, but what we do in public health is we have what are called pod sites, or points of dispensing sites. And there are about 100 of them all over the county, in addition to some private sites. And in a nutshell, these are sites that we can open literally within 24 hours, push out vaccine and or medication, and literally bring it right to the neighborhood level where people can get in and get a vaccine or whatever the medication might be. So that's the system we're exploring now.
Now, a lot of our viewers are not from the Cincinnati market. We've got viewers all over the country. So
Sure.
when we talk about what we're doing here, can they assume that the health departments in their particular areas are also as active right now in doing such things?
Absolutely. CDC has put out actually a national communication, and that goes, the CDC progression would go down through state and territorial health departments, right down to us at the local level. And nationally, they have told us to begin implementing our systems and getting things ready for vaccine distribution. And that's standard operation at this point. Again, no vaccine that we're aware of at this point. We know they're in test. Some of them are doing well. But all health departments throughout the country will have some type of distribution system in order to get things to the public.
Really interesting question I'm getting on this is, what's the likelihood that a vaccine will be required? Are you guys getting any information on that?
You know, I'm not sure that there's a vaccine requirement for anything in this country. If you look back over history, through the course of our medical history throughout the world, there's only been one disease out there that's been completely eradicated from the planet, and that's smallpox. Here in the United States, we're very fortunate. We don't hear very much anymore about tuberculosis, polio, things like that. And again, it's easy for us to say as US citizens that it's been eradicated, but those things are still prevalent in other countries, particularly in some of the lesser developed countries. We're fortunate that we have a strong public health system in this country, and vaccination has been a lead indicator in terms of tamping down some of these communicable diseases. So in terms, to get back to your question, I don't think there will be any requirements to get a vaccine. I think there would certainly be conditions where you would want to get the vaccine. I think there may be some things that are not open to people who are not vaccinated down the road. But again, that's conjecture at this point. Mm-hmm. Similar to flu vaccine, we don't require it. We certainly encourage it.
Well, and you and I talked a little bit about the flu vaccine. Will there be a susceptibility for individuals who aren't getting the flu vaccine in regards to COVID?
So from a public health perspective, this year, we are saying if there is ever a year that to get a flu vaccine, this would be the year. With COVID out there, some of the symptoms are very, very similar. We certainly have proven that you can get both simultaneously, which would be a health disaster, in addition to the fact that given the convergence of flu season, along with the global pandemic, we could really overwhelm our healthcare systems in a hurry. Somewhere between 20 and 40,000 people in this country die every year of the flu. And that's not a really common statistic that's out there, but the flu can be pretty deadly, especially for people with underlying health conditions, comorbidities and things. If there were ever a year to get a flu shot, this would be it.
Well, do you feel comfortable talking about what those underlying medical conditions are? Because I have employers who are constantly looking at me and going, I think she has, I think she's a diabetic, or she just looks like somebody who has high blood pressure, or
Sure.
he's overweight, so he's got to be susceptible.
Sure.
It's really none of their business, obviously, what their employees have in terms of medical conditions. But if we're talking about the employees themselves listening or watching the show, what should they be considering that maybe they haven't to this point?
So comorbidities for us, and again, the biggest indicator is what we call a compromised immune system. People that have immune system issues are people who may be going through cancer treatment, chemotherapy, people that have HIV that are on suppressed immune suppression drugs, those kind of things where you're really tamping down your immune system therapeutically in order not to further the disease that you have. But that also leaves you susceptible to some of the viruses and bacteria and things that are out there. So the number one thing we see is in terms of vaccine antigen is if you're compromised, you really want to work with your medical professional to talk about vaccination and what's appropriate. With COVID, we have seen very clearly that overweight people, diabetics, people with COPD or other respiratory issues are not faring nearly as well with the virus. So those are also some of the underlying health conditions and things that we really look for in vaccination.
You know, a couple of weeks ago, we had Mary Miller from Jancoa. She is a fabulous, fabulous individual. And I thoroughly love when she comes on the show because she always shares just how extensive they've made their program in regards to deodorizing, sanitizing, and cleaning their clients' facilities. But, you know, again, for those who may have not seen the show or just in basic layman terms, what information would you give to the employers or the viewers that are watching currently about the level of sanitizing and deodorizing the health department requires, or let's say not requires, but highly recommends? Because a lot of the companies that I'm going into have really tapered off on their cleaning. We'll leave a conference room and I'll expect them to start wiping down the chairs or the conference table, and nobody's even worried about it. I can't even find the sanitizer. I'm having to use my own. So can you go over that one more time from the health department?
So, you know, we've all got COVID fatigue. I'm as tired of it as everybody else is. This has been going on all year.
Yeah.
We're tired of it. I feel your pain. I see the employer's pain.
Yeah.
To flip that script around a little bit, we're also seeing some people in the work world, the retailers that we regulate and or license, the restaurants, the bars, the food service facilities, some of the larger big box retail establishments are absolutely doing a knockout job of keeping their customers safe. From an employment perspective, and I guess if you're a public facing business, you're really sending a message to your consuming public out there that you care. When you walk in, when Joe consumer or Susie consumer walks into your outlet and you're masked and you're distant and you're cleaned up and have sanitization products available for them, that really says something about your business and about your care for the public. And we're seeing a lot of these businesses in our world do a great job. Is it easy to lose sight of it? Of course it is. This is new to all of us. We're tired of it. It's 8 months into the year, 9 months into the year. And sure, we let our guard down. We see it all the time, but we've seen many, many business statements. I see letters to the editor. I see commercials. I see people, you know, on social media talking about the businesses that are really doing a good job. And we're seeing some of the businesses, at least locally where I am, knock it out of the park in terms of using that for marketing messages.
Mm-hmm. Mm-hmm. Okay, now I'm going to ask you, this is kind of for me, but just how likely is it that the virus can pass on cash? Because it just kills me when I go into some of these places and they're saying, oh, no, we're credit card only. And I said, well, for how long? Oh, we don't know. It could be indefinitely. I mean, I carry cash all the time, but
Sure.
not much, but so what's the likelihood that the virus is actually potentially maybe never on the cash currency?
So your question speaks exactly to the novelty of the coronavirus. It's new and we learn about it every day. Early on at the outset of the virus, there was a huge push for sanitization, for gloving, for all of those things. And I think over the last couple months, we've all heard the CDC say, yes, while it is able to be passed on surfaces, that's not the primary transmission vehicle. It can be done, but not nearly in as much fury as we thought beforehand. So yes, it can pass on cash. Yes, it can pass surface to surface, but not nearly as readily as through direct respiratory droplets, close proximity to one another, or any of the other things that we're seeing out there in terms of social distancing.
Okay. I had someone mention yesterday that they wanted to take a bunch of stuff to Goodwill, and then she said, oh my gosh, I probably can't because the virus could be on this stuff, or I can't go to Goodwill because I can't, I don't know who's actually touching it. And I'm thinking, my gosh, I just went to the mall and I did shopping. I wasn't worried about the person next to me touching the product that I had in my hands at the time. So I mean, is there a time period by which something should be set aside to be assured that the virus is gone?
So the real issue there is if you pick up a viral particle or some piece of the virus or a direct exhalation from somebody who's infected, I think what you're hearing now is let's not touch our face. I read something just the other day where the average person touches his or her face 15 to 20 times a minute. And we do it unconsciously. I do it all the time. I mean, you touch your hair, you touch your ears, you touch your eyes. But if you look at your face, your eyes, your nose, your mouth, that's where all your mucous membranes live. And if you're going to transmit virus, that's where it goes. So again, the surface is not so much the issue as it is bringing that surface into your mucous membranes and then transmitting the virus. So again, that's where hand washing comes in, where sanitization comes in and all that. But again, I think the bigger issue is proximity to one another, covering your coughs, masking. And again, one of the things that we see all the time, and this is certainly valid in the employment world, is for goodness sake, stay home if you're sick. We see people who, whether it be work ethic or fear of missing a check or, whatever their motivation is, they're going to work when they don't feel well. And that, congregate settings, close proximity to one another is the biggest spreader of COVID that we've seen. So for employers out there, we're really urging them to encourage your folks to stay home when they're ill. They can really come in and wreak havoc on your business if they come in infected and so on. So I know we at the health department have implemented additional sick time to ward people off who may be at the end of their usable time, their vacation and leave time. We've implemented additional for people to please don't even think about it. Stay home if you're sick.
Yeah, that's a really good point. I was even getting calls from clients that have, let's say the HVAC guys that have to go out on client sites, and their justification is, well, I'm outside, I'm not even around anybody, and I'm saying, stay home. What about all the people in between, or the people that you come in contact with at the fast food restaurant or wherever you're doing in between? It's not just the customer and your employer. So thank you for adding that, because that's extremely important. We have recommended here on the show to most of our clients, in every case, a self-reporting policy. If the employee does not feel good, just self-report it. Don't wait till somebody comes over and taps you on the shoulder and asks what's going on. I'm going to take you back one more question though for employers, because this is the stuff I get questions on. Just how often should the employer bathroom or the business bathroom or public bathroom be cleaned according to the health department? Because individuals are now talking that they want to run out as they're flushing because of the water coming up and all the potential exposure there. Is that myth or is that fact?
There's some fact to that. I'm not sure that that's the overarch there. If you can get your public facing facilities, we do ours here 3 times a day. Is that enough? Is it ever enough? Can we ever clean enough? Are you ever too clean, too good looking, too wealthy? It's kind of one of those things where the more you can do it, the better off you'll be. But again, I would venture a guess that the majority of us are not in the sanitization business, and we do the best we can. Again, that's where wearing a mask comes in. So the analogy to all of this, the hand washing, the covering coughs and sneezes, the mask wearing, all of that, the analogy is like Swiss cheese. A piece of Swiss cheese has lots of holes in it. and you put that down. And then if you layer another piece of Swiss cheese on top of that, well, that'll cover some of those holes on the first piece, even though that has holes. And the third piece of Swiss cheese, perhaps you can get all those holes covered. So if you talk about washing your hands, maintaining distance from one another, wearing the mask, those are all layers of Swiss cheese that, as we rely on each of them together, they make a pretty strong barrier. And we've seen it time and time again where it's incredibly effective when those things are used and used well and reliably.
I love it. And I may steal that from you, actually.
Please do.
When we're talking about, again, we try really hard to provide solutions here on this show. And when we're talking to entrepreneurs or business owners, we're always pre-warning them, look, you are susceptible to being reported to the health department. And one of my clients had the health department show up, and they had to show bright pictures that they had provided the remedies. What are can you help me with this? What are the top reasons employees will report their employers to the health department?
Overwhelmingly, it's mask wearing. At least for us, this is what we see. We're handling anywhere from 30 to 70 complaints a day here.
Oh my gosh.
Oh, and this is just now, early on in the pandemic, it was all hands on 24/7. It was unreal. But people are starting to gain an understanding, but overwhelmingly masking is the number one complaint we see, followed by, as employers out here, as HR folks that we all are, a lot of people don't want to go to work. A lot of people have stayed home and said, gee, I can make more money on unemployment, or when Uncle Sam kicks me in another $600 or something like that. No, my workplace isn't safe. And it's important that we ferret that out, because that's not fair to anybody.
Right. Now we go back to the masks, though. Is it that they don't provide the masks? Is it they are asking them or requiring them to wear them? What is
It's that they're either not wearing them, they're not wearing them properly, especially in retail. You'll see people that have, and these are hard to wear all day. It's hot, they're uncomfortable, it's hard to breathe. And sometimes we'll see people pull them down under their nose, wear them around their neck, hang them off their ear just for a minute. And, usually these people maybe they're just trying to catch a breath, and they were caught at that second by some customer who said, my God, I went into XYZ grocer and they're not wearing masks. Maybe the kid pulled it off for a second just to catch a breath. I don't know. But any complaint that we receive is followed up on within 24 hours. Overwhelmingly, the businesses that we work with want to comply. They want to be healthy. They want to do this stuff. I feel for them. The direction changes all the time. This is not an area that any of us have ever been in, let alone tried to run a business in before. So our approach here is much more education over enforcement. We're not an enforcement arm. We're a health department. Certainly the media likes to focus on enforcement, and it's gotten to the point where I'll tell the media, yeah, we're going to bring out the black helicopters and the National Guard for this one. That's it. No more without masks. And it's just one of those things that we just have to keep doing it. And it's like the movie Groundhog Day, over and over again. We just got to keep doing it.
Yeah, wouldn't you love to know what Bill Murray's really doing right now?
Probably laughing.
I wish he'd do a movie on this.
Yeah.
Do you have an opinion of the gator? Because we talked about that a couple of weeks ago with a representative from Workers' Comp. I think it was Duke University that was coming out with a report stating that they didn't feel the gator was as effective as actual masks. Does the health department have any position on that?
It's interesting that you asked that, because we just bought masks for all of our staff here, decent quality masks that they could have reusably, because we were going through the paper ones. We're out inspecting restaurants and out and about all the time, so our masks don't last very long. So we looked at gaiters. The CDC just in the last couple of weeks came out with a piece that found them not as effective as masks.
Okay.
They're usually one layer. A decent mask will have multiple layers and or a spot for a filter to pop in there. So again, like the Swiss cheese analogy, the more layers you can provide between your excretion, your respiratory droplets, and the people around you, the better it would be. So the gaiters tend to be made of a really porous, lightweight material. They're often pulled up and not completely covering. So CDC has said they're not as effective. Would I rather see a gaiter than nothing? Absolutely.
Yeah. Mike, this is just, I could keep going on and on and on and on. What have I not asked you that you feel is important for the viewers?
When is this going to end?
Well, wait a minute, I meant a real question, not a rhetorical question.
And again, there's a lot of talk, especially with an election year coming up. There's a lot of talk about imminent vaccination and so on. And I would tell you, manage your enthusiasm for that. Even if there was a vaccine that were approved literally this afternoon, you're talking about the manufacturing world having to then go in and literally crank out billions of doses, redistributed across the globe, decide who in the hierarchy of healthcare gets the first vaccines. So this is not something that's going to just happen one day. Oh, we've got a vaccine, this is over. As Dr. Fauci has said, Dr. Birx, Dr. Redfield from the CDC, we're looking well into next year to be living with this, and it's just going to change the way we live for now. It'll be interesting to see what kind of long-term changes are made, what this means for us going down the road. This won't be the last pandemic. Hopefully it's the last one we see. It's been 100 years since the last one, but there'll be more of these. And as we become a more global society, as travel is accessible, just think in 1918 when Spanish flu was here, it took the servicemen weeks to get home from Europe. Now we can be home from Europe and overnight. So pandemics will be with us for the future, and how we learn and how we function during them will be invaluable.
How long have you been with the health department?
About 10 years.
10 years. You plan on being there in 10 more years? After this?
That's a great question. I'm not quite sure I have 10 left, but maybe 5.
Well, Mike, I want to have you back on the show. It's projected that we're going to have the show through the end of the year, and I just can't imagine things slowing down at all, that there isn't going to be new information and more interesting stuff for you to share with us. So I really want to thank you for, again, making time to come in and share with the viewers all this information. It answered a lot of questions, and I'm sure that everyone really enjoyed hearing you. Thank you.
It's been my pleasure. Thanks for having me.
Thank you. Well, Bill, now that we know that businesses are going to have to stay kind of tight on their cleaning and their sanitizing, and employees are not going to be able to get rid of these masks, what can we do to make them happy in terms of all the other parts of the operations?
Well, I think the thing that we want to talk about is that businesses are struggling to maintain some level of profitability, and that every business has been affected somehow, some way by the COVID virus on their financial statements. And it's affecting every business. And so I think what we had talked about was trying to identify what should a business owner do to try to manage his business for more profitability during this COVID situation. And I think I came up with a top 10 list, and then we could probably expand it with other ideas, but I think to me, every business is in a way unique. So some of these ideas will not apply to some businesses, but other ideas will apply to those businesses. And so to me, one thing that I think I would recommend all business owners do is review their internal operations, and you need to identify where you can maybe cut costs to deliver your product or service. How can you be more efficient in the delivery of your product and service? Can you use computers and technology more effectively in your operational business, so that you can, again, the idea is potentially to allow your workers to be more productive in the workforce, allows you to, hopefully, to grow your business and not have to add employees. Or quite frankly, if you are more efficient, you may need to then look at your staffing levels. And that would be the number two thing that I would look at is, are you overstaffed? And really, restaurants had to deal with this immediately. I mean, they're at 50% capacity, 25% capacity. How can you justify keeping the same staffing levels? And so you really, a restaurant, a lot of businesses that are retail oriented, they really do need to look at their staffing levels and manage the hours that their people work in order to stay in business. Because if the business tanks, everybody loses their job.
Yeah.
And so it is, I think, very important that business owners look at their staff. There's an old adage that probably every year you can eliminate 10% of your staff, and it's probably your low performers statistically.
Hold right there, Bill, because your first one actually connects into the second one, and it goes back to something we talked about here on a couple of previous shows. Let's take HR, for instance. You know, when I started 40 years ago in HR, everything was paper. I was still using a typewriter. Now, when people ask me what HR is, I flat out say HR is more automated and more electronic. And there are so many different systems to remove things from the responsibilities of an HR person than there ever has been. So when you're saying, look at what systems you have in place and what can you do electronically or what can you change from an IT perspective, the first thing that comes to me is payroll processes, timekeeping processes, benefits administration. That's all. My gosh, there's phenomenal ways to do benefit administration where employees can actually do it online and it automatically integrates into the payroll system. So there's no more inputting of the deductions. There's no inputting of the programs. When we talk about inventory systems, my goodness, there's so many ways to shortcut inventory systems and eliminate paper there. So when you start watching that kind of go down the line, your first 2 points have such a trickle down effect that they could be saving money in all sorts of different levels of the business.
Exactly. And I think you also need to look at your compensation and your bonus plans. So you may want to incentivize your employees in a different manner than maybe you have in the past, so that you may want to restructure your compensation with your employees and identify what you're going to bonus employees for. You're going to reward the behavior that's going to allow the company to hopefully be more profitable in the business. And so that, I think that's something that you need to evaluate on a case-by-case basis. But those are a couple of really good ideas to start with. Number 3 I would work with is reviewing your financial statements. You may have a CPA or a bookkeeper or some type of controller, chief financial officer, but the business owner really needs to understand the books. You need to review your financial statements, hopefully on a monthly basis, at a minimum on a quarterly basis. And you want to identify trends. You want to see how your sales are going. What's the trend for your cost of goods sold? If you have a product or service that, what is your gross profit? In other words, what are your direct costs that are incurred in delivering that product or providing that service? And how are your margins working out? Are you being more profitable, particularly if you're in construction? You always want to try to manage your margins in construction. And then you also want to look at your payroll costs and see how they relate to your sales. And that can be a direct correlation to document whether or not you're in a good trend relative to how much sales you're generating and how much your payroll is, and what is that relative percentage, and how does that relate to the past 3 years?
Bill, what do you feel is a good, healthy percentage when you look at that comparison?
Well, every business is really unique. So, there's an old adage in restaurants that your payroll should be a third of your sales. You have these old rules of thumb that are out there.
Yeah.
But what I tend to recommend is it doesn't matter what they say the industry average is. Look at your last 3 years and find out exactly what your business has been doing and how you're doing this year compared to last year. That, to me, is the litmus test. And you might have a goal that maybe you're below the industry average, and then you got to try to evaluate. That would be a way of saying, well, I've always consistently been below the industry average. Maybe I need to change the way that I'm doing some things. And that's a decision that is unique to every business, quite frankly. And then also, I think that your administrative costs, you need to look and your major costs. You're not going to try to manage something that's $500 a year, but if it's $50,000 a year, if it's $10,000 a year, every business is a different size. And so you want to identify your major costs and really manage those costs. It's that 80-20 rule that 80% of your expenses are really 20% of your costs. Okay, so you can focus on the top 20% of the different types of expenses that your business has. That's where you get bang for your buck. And that leads into the next item that I would say, that basically you may want to get competitive bids. It could be your credit card processing, payroll processing, phone, internet, your IT costs, your suppliers, any other major expense. If it's a major expense, then you may want to go to a competitor and get a quote. And so that is something that is just being strategic in what you do and how you do it. And so it gives you some guides as to how you can hopefully take action and hopefully take and reduce some of your competitive. And so you may have different departments. So sometimes you may want to evaluate whether you need to close or consolidate a business center or a different department or a different location. You'll see a lot of the retail restaurants closing some locations and not others. What's common sense? You're going to close the underperforming locations. And then hopefully the people are going to go to the other locations and continue. They want your product or service. And so you find out where they are. And so that's a strategic thing that a lot of retail businesses have done. They have numerous locations around Cincinnati, but several of the locations they've closed. And it's just very strategic in doing that.
You know, that's one of the hardest decisions for a business owner to do, is all of a sudden accept the reality that a particular line of their business or a particular product that they've produced, or maybe it was the core of the business that they started with 20 years ago, isn't the most profitable, and it becomes a very sentimental.
Exactly.
I have heard a number of companies look at me and go, you know, all these years we thought that was the core of what we did and why people came to us, and now we're looking at it and realizing it really wasn't what anybody really needed. They just bought it, or they used it because
exactly.
they had it. And we're actually having to rethink and go in an entirely different direction. One of my clients was just amazing in that they said, you know, about 5% of our business was e-commerce prior to COVID. Now COVID has literally launched that division, and they've increased by 500%. That's division of their business alone, which has had them rethink some of their other core focus and realize, oh my gosh, the people that we had over here, we don't necessarily need anymore. Now we're having to hire people with this other expertise that we never realized we were ever going to need. So that's a really good one, if people are strong enough and brave enough to look at the reality of that.
Right. Another thing that business owners need to focus on is they need to reduce their bad debts. Some of your customers are struggling and they're not going to be paying you timely, and you don't want to let those accounts receivable stretch out. One suggestion would be to offer discounts for them to make payments on a timely basis, or even you might even change your pricing structure. If a customer is slow pay, you put them on COD. You put them on, they got to pay up front for the whole thing, or maybe they got to make an advance payment, because the bottom line is that you can't be having significant bad debts in this COVID situation. So you really need to manage your accounts receivable and your collections. And you need to be focused on maybe even changing some of your strategies. If someone is slow paying, it should set off an alarm to you that this could be a problem, and you don't want to just not manage it and let them get extended out another 30 or 60 days. Because depending on your profit margin, you're throwing a lot of money away. If you have a customer that you lose $10,000, you might need to get $30,000 in sales to replace that profit that you just lost. Okay, so it depends on your margin in your business. So you got to be very, very careful. And if you're a low margin business, some people, when you have all your expenses tied in, they're only making 10 cents of profit in the bottom line for every dollar of sales. They might have $1 million in sales and they're making $100,000. Well, if you have a customer and that's your margin and that's your bottom line, you got all these expenses, in your business. And it's going to take a lot of money, a lot of sales to make up one customer that loses $50,000 or $10,000. So you do have to manage your accounts receivable. Another thing, yes?
Is there any?
I don't know how much time we got left. That's why I was trying to focus on this.
We got lots of time. Is there any major advantage to having payments brought in by ACH? Because I had a client that called me the other day and said, hey, I'm just going to pay you ACH. And I thought, oh my gosh, I should have been asking for that. Is there an advantage to that?
You save credit card fees. So if people are paying by credit card, or you're saving processing fees, that somebody's got to take a check, record it, cash it. But if you have an ACH payment, you still have to record the payment, but you don't have the time and expense of getting checks in and endorsing the checks and getting them deposited in the bank. So whether you have credit card payments or check payments, ACH is a more effective, cost-effective way to collect your accounts receivable.
And is there a hefty bank expense to that? Does the bank charge you, or are there charges?
No, I have clients that just send me an ACH payment for $1,000, and now it depends on the sender side whether they would charge a fee, and I don't know. I mean, on the receiver side, you don't have a fee.
Got it.
But even from the sender side, they're going to have an expense writing a check, so they're going to have an expense. It might be more cost effective for the sender to use ACH payments instead of writing checks.
Got it. See, I just learned something. You may have just helped my business. Go ahead.
Another thing, everybody has insurance. So I think it is important to potentially look at all of your insurance and have maybe another insurance agent. One of the important things is to review your insurance to make sure it's adequate. Your property and casualty insurance, your life insurance, your health insurance, disability insurance, your dental insurance. It isn't just a question of the cost, but it's a matter of getting bang for your buck. And some people might be underinsured, and that could be a major problem. You may not have an insurance coverage. Like even myself, I have tax returns that I process in my computer. So I've got internet protection in insurance if I have my system hacked. So that's prudent for me as a business owner to protect my clients and have that insurance coverage, because I got my IT person, I got firewall set up. I got insurance to cover if somebody got into my system, but at the same time, that insurance policy requires me to have certain standards that I give to my IT person every year to make sure we're meeting the minimum standards, because I won't be able to collect on the insurance if I'm negligent in what I'm doing with my computer systems. So it all ties hand in hand that you need to plan to make sure that you're protecting yourself from basically any type of liability or insurance claim. You could have a fire, and you got to make sure that your property is adequately insured. If you're underinsured and you don't have enough insurance, then if you have a fire loss, you're not going to get full recovery for your loss. And then the other thing is, it does help to have competitive bids. Why not? And so, those are some simple things that every business owner can do, whether it's their health insurance they're trying to manage. They might want to join a chamber of commerce and get a discount. And that leads into the other thing. Look for the chamber of commerce for discounts. One of the simplest things in Ohio and Kentucky is to join the chamber and you get a discount on your health insurance. I joined the Norwood Chamber, $75 a year, and I get a discount on my health insurance. So aside from being involved in the chamber here locally, and I'm involved in other chambers, the Madeira Chamber, the Northern Kentucky Chamber, they all have discounts that they offer chamber members that work with them. And so that's another strategy if you're involved in the chamber, check out with the chamber what kind of discounts chamber members are offering other chamber members. I know the Northern Kentucky Chamber has actively been doing that for years. So and I'm sure the Cincinnati Chamber has the same thing. So you don't want to work with not just the Chamber of Commerce, but quite frankly, in this COVID situation, I have clients asking me for a discount. If you're in business, why not ask for a discount? It doesn't matter if it's a chamber discount, you ask for it. And sometimes they say yes, and sometimes they say no. And I take that into consideration with my clients. If they're having difficult times, I'm going to hang in there and I'm going to work with them. I'm happy to give a client a discount that I feel is needy and they've been a client for a long time. And so I feel they're deserving of a discount. We have to share the pain. And that's what a good business owner is, that you're partners with your customers and you take that into consideration with your customers from that standpoint. So sometimes you not only ask for it, but sometimes some of your customers, when you're collecting your accounts receivable, you want to keep the customer. You got to evaluate that situation. And it may be better to give one of your customers a discount than to keep your price point the same and lose a customer the next month or next year. Okay, they're going to go shopping. And that's what happened in the recession in 2008. And that was the first year that I didn't raise prices, was 2009 in my practice. So I'm evaluating that for next year, depending on COVID-19, whether we're going to just freeze our billing rates again, our price point. I think every business has to evaluate what they're going to do next year and communicate that with their clients. So I think that's, and one thing I would say, I'm trying to wrap up some of the other ideas that I have. I have a couple more. Number 9 is that I think you need to manage all your expenses when you get a bill. In other words, you don't just go out and have to give bids, but I look at every bill when it comes across my desk and I sign my check to pay every invoice. Do I need this service? Should I get a quote? Should I ask for a discount? Should I reduce the level of service? How can I look at that cost and that expense, and how can I kind of reduce that expense? And so that's something that I encourage business owners to do basically every day. That's how to manage your expenses. Every day when you sign a check, look at that check, look at the invoice and say, can I reduce this cost? Do I really need this service? And start asking those questions. And you try to, basically what you're trying to do is eliminate the fat. Okay.
And that's a really good point, Bill, because just this past week, I've had 2 companies look at me and say, look, I've been paying these other organizations for years and I've never gotten anything from them. They're flipping over to our services because we talk to them every month. And that's, I even canceled a membership at a club because I just wasn't going enough to participate and to spend on it. And I actually intended to use it for the conference room and some of the facilities they offer. And now COVID's changed all that. People don't want to be around a conference room. I don't need that facility anymore. So that's a very good point. If you're a member of an organization or association, make sure you're getting your money's worth. That's real easy. Good one. I love that one.
And last but not least, and this is really, quite frankly, the most important thing that business owners should do, okay? To me, it's all about sales and marketing. You can cut your expenses. That's one side of the equation. But quite frankly, I was living proof of that when the recession hit in 2008. I doubled my law firm business in the recession. This just because there's COVID and just because there's a recession out there, just because there's higher unemployment, there's still 90% of the people employed out there. And it's an opportunity, is what I found, for sales and marketing, that you need to really focus on your sales and marketing. And that is one of the solutions of getting through this COVID situation. And you see a lot of entrepreneurs being very creative in what they've done. A lot of restaurants you saw did the takeout delivery. They have packaged meals that you can come and pick it up and take it home. You have to be creative in this environment. There's no way that you can't just do what you've always done and be successful. And so from that standpoint, in my marketing, I look at my website. It's so important today for businesses to have a very good, effective website. That's the first place people go when they're going to buy a product or service. They check out your website. Also, you need to be focused on your social media marketing. That's where people are really reaching. That's where you can reach a lot of people in a very cost-effective basis. So I'm focusing my marketing on Facebook and LinkedIn. And I actually went to a national program seminar and talked to a national expert on the 3 things I should be doing for my law firm marketing. And he indicated it was your website was number 1. Number 2 is Facebook, and number 3 was LinkedIn. So I went to a national program and found out what I was doing. I was right on track. And quite frankly, I can tell you this. Last year, my law firm grew 15 or 20%. Before COVID happened, we were on a 20% increase this year also. My law firm has compensated for the decline in business of my CPA firm. When COVID happened and they didn't do extensions April 15th, I lost business because there was no extensions to do from the end of March to the middle of April. All those returns we did in April, May, and June did not need to get extended. We lost that business. That service was not required. Those returns that were filed by July 15th did not have normally what we would have to do is prepare an estimate and do a projection and file extensions in order to get through the tax deadline. So what I'm trying to share with you, I'm actually started when the COVID happened in March. I started in April attacking my marketing strategies with my law firm. We went after funeral homes. We went after assisted living facilities. We'd never done that in 26 years. And we started creating strategic relationships with assisted living facilities, independent living facilities, funeral homes. And they're doing pre-funeral planning. They need estate planning. People are going to be going to independent living from assisted living. They need to work on their estate planning. And we're establishing strategic relationships with people that do in-home care. What I'm trying to say is that when COVID happened, I acted immediately. And within 2 months, we had developed strategic relationships and strategic partnerships with other companies within town that naturally would need a good law firm to help them. And we also focus on our website. So we've been doing a lot of blog posting, a lot of Facebook posting. And what I can share with you is that this is where a business goes from sales to marketing, is that when I first started my business, I was out networking, and that's what you call sales. But when you have your internet, and you have the website set up, and you have your social media campaign going, you sit back, and that's marketing, because people are searching out who they need and they contact the company directly. And so today we get calls every day from people that found me by Googling that they needed an attorney on the internet. That is the strategic change that I've made in my business in order to be more competitive going forward with COVID-19, not only this year, but I think he was right. We're going to have this through next year. It's not going to go away. So.
No, I think we're stuck with it. That's why we have to surround ourselves with people who know more and are better at what they do, whether it's the CPA, whether it's your attorney, whether it's your employee benefits provider, whether it's your HR consultant or your labor law attorney. Yep. You absolutely have to surround yourself with people who are better so that you can stay ahead of this and be brave enough to do what you haven't done in the past. I mean, the phrase, chaos. Well, we're going beyond chaos now. We are being forced to do what we've never done before. Bill, I want to ask you real quick. What's the big secret with the Form 941 and some of the changes there due to COVID? Is there any advice that you want to give to business owners about that?
Beware, don't take advantage of Trump's deferral of the payroll taxes. It sounds nice. It sounds like you're being nice and generous to your employees, but the company remains liable for the payment of those payroll taxes in 2021. And if the employee doesn't pay, they got to go after the employee for the money, because they're going to be liable to the government for the money that they should have withheld from their employees. So it's a big trap, quite frankly, that I would have an employer be very cautious. They've issued some guidelines that they're implementing that would allow employers not to withhold Social Security taxes on their employees. The problem you're going to have is you got to collect that next year. And what if they don't work for you next year? They're gone. They change companies. Or what if they just leave for whatever reason? Or what if, that's the bottom line, because you're going to be required to withhold that extra money out of their paycheck. And I got to tell you, 75% of the people out there are paycheck to paycheck. Yeah. So you do not want to be in a situation where you're going to, not withhold Social Security taxes. And then at the end of the day, the company is liable for that tax liability, and they've got to be able to collect it from the employee that's paycheck to paycheck. I think it's a potentially major problem. It's not any type of forgiveness program. It's just a deferral program. And I don't really recommend, and that's the point. Companies are not required to offer the deferral to their employees. They're not required to do that. Okay.
Yeah. Thank you, because I think that's the general consensus that we're getting from all the CPAs that we
absolutely.
Quite frankly, I haven't talked to an employer who even wants to even consider it. It's right. The employees are coming up and asking, do I have to do it? Yeah. Frankly, the employees, from what I'm gathering, aren't interested in, because they understand the responsibility down the road, and they don't want to be thinking about how much money they're going to have.
Exactly.
So yeah, good. Bill, thank you. My gosh. Again, when we first started talking about this, I was trying to come up with 10 ways to save or just cut costs, cut costs. And you flipped it completely different. It's the profitability of the company. And I want to emphasize too, I mean, again, I'm 1 to 3 people, depending on how much workload I've got in terms of my company. Right. There are other companies that are just one individual. We, as small companies, we can still apply a lot of those principles. And that's a good information, no matter what size your company, to write down.
Well, and actually, you outsource. You have part-time people. You outsource different services. So that's a good strategy that people need to consider, that they don't need a full-time person, so they hire a part-time person.
Right, exactly. And there are other ways of working around that as well. But
exactly.
Again, Bill Hesh, with all the answers, with all the solutions.
Well, I had a technical glitch. My phone was running. My battery was almost dead, so I had to jump up and put the charger on it. So that's where I'm at right now.
I thought you just wanted us to see your
That's what happened.
Okay. Viewers, if you have any questions or would like a copy of his list, let me see, where have I got? The top 10 things to do to be more profitable in your business by Bill Hesh. He will be more than happy to send that to you. Just reach out to Bill. What's your email address?
It's Bill.Hesh, H-E-S-C-H at WilliamHesh.com. William is spelled out, WilliamHesh.com.
Okay. And
also, it's heshlaw.com is the website, and you can get the email address there.
There you go. Or contact the station, and I'll be more than happy to send it to you. If we're flipping back over to HR, then there are just a couple things we need to go over, just to remind everybody that, again, things aren't changing on our side. But a big one, which I thought was kind of interesting, and Mike, if you can jump in on this one because it involves the CDC. We just got an announcement that the federal government has adjusted the COVID-19 entry strategy for international air passengers. Now, for some of you who have employees that are traveling abroad, this is very relevant to you. It's also very interesting enough to talk about people who are going on vacations, and just the whole movement of our country. Bill, Mike, do you have any depth of understanding of this?
I know that they've quit doing the temperature checks and some of those things at the airport. The caution, and again, there's a bunch of ways to look at that, and we could go on forever on it. But what I would caution anybody that's listening is what we're seeing in terms of asymptomatic carrying and/or spread of this virus. Again, I can see why they would suspend that at airports, but the asymptomatic ability, the ability to carry COVID-19 asymptomatically and spread it asymptomatically is much, much greater than we thought. So something to consider as you're coming back and forth. You may feel fine and you may be completely infected.
So with that said,
it's not comforting. I got you.
If you're an employer who has an employee that's traveling out of the country, either to one of your locations or maybe on vacation, you need to think very, very hard about, number one, making sure you've got that self-reporting policy in place. So if they do feel any symptoms at all, they're communicating that with you, and you can make an educated decision on the safety and security of your workforce before they come back.
It's easy to find positivity numbers for where you're going or where you have to go or whatnot. It's easy to look at areas of high positivity you may want to avoid for the near future.
Yeah, and again, that's just best practices at this point. But
sure.
Again, all those locations are on the website for the CDC in terms of hotspots. So we still have a number of them here in the country. A number of
Absolutely.
States and municipalities are still hotspots. So let's just keep our radar on that and stay focused. I also want to make sure that everybody understands that the EEOC has recently put out some guidance in regards to teleworking and how that relates to accommodations. If you have somebody that you've allowed to telework from home because of the pandemic, that does not necessarily mean that the essential work functions for that role have permanently changed. So if you need guidance on whether you can accommodate the continuation of teleworking or have to accommodate those requests, please make sure that you understand that guidance. Talk to your HR consultant or your labor law attorney, and they will walk you through that. Again, this is a special condition under the pandemic, and these are the kind of things you have to know about, because ADA is for most employers 15 employees or more. I also want to make sure that everybody understands that the EEOC updated the Q&A for the ADA Rehabilitation Act and other EEOC laws. It is let's see, a 24-page document, but 18 of the Q&As on that document have been updated as of September 8th. I don't expect you to read the entire document, but I do expect you, if you have any concerns under those guidelines of ADA, to contact your HR consultant. Again, that's our job, to be reading those guidelines and to help you walk through those. Some of them are big changes, some of them are slight changes. Again, your labor law attorney would also be another great source. Guys, thank you so much for being with us. Thank you, ICRC-TV, for one more hour, and we hope to all see you next week. My name is Pandy Pridemore. Take care.